It depends tonight.
No, talk about this voting session here. You asked about caucus. I'm like, wait.
That depends on how. That depends on you all.
We are live, sir.
Oh,
Depends on Jay
Thank
Wall.
you.
I told y'all he was vengeful. I said it on the floor.
Good afternoon, everyone. I'd like to take this opportunity to welcome everyone to the House Economic Matters Committee. Today is Thursday, April 1st, 2021, and that is no April Fools. We are here to go over 1, 2, 7 bills, but we will start first with a couple of amendments that have been offered to House Bill 581, I believe it is. 581. Laura, would you please?
Sure. So we have 2 amendments, one from Delegate Kipke and one from Delegate Buckle. The amendment from Delegate Kipke would require a testing facility instead of an employer to report test results to the Department of Health.
Say that. I'm sorry. Can you give me that one more time, please?
So the bill contains a requirement that an employer submit test results to the Department of Health. And this amendment would change switch the onus and say instead that a testing facility is required to share that information with the Department of Health.
Do we
No,
know
that's-
what is done now when they get their numbers?
It's already done.
But the bill, I think, was also sort of trying to do, I'm sorry, I didn't raise my hand, was trying
Go on.
Like by industry or, business sector. And I don't know if the health department can do that, or we'd have to indicate that they would have to ask for their employment information, I guess.
Right.
But the goal, I thought, was just what Madam Vice Chair said. We're trying to make sure that this is done by industry, and more so that the health department is made aware as soon as there's a communicable disease outbreak in these industries. And we don't want to rely on the fact that somebody goes and says and divulges whatever information they divulge, because I don't even know if you have to divulge where you worked at. So we want to make sure that this is just to ensure that these communicable diseases don't spread in these work environments, which is the whole goal of the bill, to make a safe and healthy work environment. So I don't think the amendment, I think it undoes what we're trying to do.
Mr. Chairman.
Yes.
Yeah. So I had some concerns, and I'll just add one thing that, the private Maryland laboratories currently have reported every, COVID test, negative or positive. That's already being done to the Department of Health. It includes all information on race, sex, ethnicity, age. And the requirement could have a tendency to duplicate the records. And so just for statistical purposes, I'm being told that as of April 1st, the testing volume on the state's dashboard shows 8.8 million tests that have been reported. And that's because there's a system in place that asking private employers to do the same thing. I would question whether you'd have duplicate effort, and 2, would you actually get as good a statistical record when not every employer is going to understand, and some may not be easily willing to provide that information. So there's some open concern I have about asking an employer to do something they're not usually accustomed to doing, which is reporting results to the Department of Health.
Okay. Delegate Impalaria.
Yeah, I personally think it's a friendly amendment. You shouldn't put the employer in a position where he's asking questions that could be a violation of HIPAA that the person doesn't need to give them. Also, the double reporting, because if the business owner then reports it and so does the Department of Health or whoever did the testing reports it, then you have a double reporting. And the truth of the matter is now their numbers are going up, but they're really not. Another problem that we're seeing is people are being tested positive. It's being sent in as positive. Then they go to their own home health care and they go for a better test. And when they get the better test, they find out they're not positive. They're never removed from the numbers saying that, they never were positive. Look what happened over in the Senate with all the senators being said that they were positive. I guarantee you that they're all still shown as positive test results, even though those test results were wrong. I think by keeping it narrow, this is a much more friendly, a much more accurate amendment, and it keeps the burden off of businesses from possible lawsuits, from losing employees over it. So, what happens when the guy goes to his employer and says, they said I have COVID, then 3 days later he gets tested and he doesn't have COVID. So,
Comes back.
right. So I think it's a friendly amendment.
Delegate Charcuti.
Thank you, Mr. Chair. I would suggest we resist the amendment because the whole point of this bill is to create healthy workplaces. And if workplaces aren't tracking and Department of Health isn't able to track by workplace, then we're not able to create healthy workplaces. I trust that the Department of Health has the capacity to only track for the statewide dashboard and data, to track one set of data that comes from testing for our overall numbers and a different set of data that comes from workplaces for our workplace safety plan. And I would trust them to be able to do that. And I hope that we reject this amendment.
Delegate Wilson.
Mr. Chair, again, I said earlier, the goal is healthy work environment here. It's not a HIPAA violation. We've gotten the AG's letter. Let's make that clear. It is not a HIPAA violation. All right, we've gotten that clear. So we know that's not a HIPAA violation. But here's the other issue. Like when I had issues with my law firm, I took the entire law firm to Dahlgren, Virginia to get tested. Why? Because there were no openings. I go to the closest, not the closest, the quickest facility. We go to DC, we go to Virginia. So if we do that under this theory, we'll never know. The goal is a healthy work environment. Therefore, we need to know not just from where you got tested, but from where you could have possibly infected. So again, if you test out of state, the argument here is pretty much it's pointless. We don't just want to know statistics. Statistics are very secondary to the health of the employees. I apologize. So this amendment undoes what we're trying to do.
Delegate Pippy.
Thank you, Mr. Chairman. I just want to understand something, and I wasn't on the work group, so forgive me. There is not testing employees. The employer does not at this point have the capacity to test an employee. So an employer essentially would send an employee to get tested, or the employee would go get tested at a separate facility. And that facility is probably required to, I would imagine, law or executive order to report that to the health department. So why would we then require the employer to send a separate notification? I mean, it's almost like hearsay, because the employer is not able to test these individuals. The employee is going to get tested, and that information has to go to the health department already. Just from a practical standpoint, I don't know why you would want the duplication. And I feel like there'd probably be quite a bit of confusion, because you could have an employer reporting something that may not be true, as was mentioned earlier, or you could have an employer that's reporting something that's already been reported. And I don't know. I mean, I get the accountability, and you want to know if there's an outbreak at the employer's location, but I don't know if this is the right vehicle for that. That's why it kind of makes sense, the amendment in my eyes. I don't know what the downside to it would be, but.
I just explained that if they get tested out of state, we have no way of knowing. By this amendment, if they get tested out of state, that's going to be reported to Virginia. We have no way of knowing anything that goes on in that workplace unless the employer reports it.
Do something related to, sorry, Mr. Chair, if I could respond. Could we do something related to maybe if there's an out-of-state test? I mean, that would be more narrow, and that would make sense, because you're right. It would be maybe reported to a different agency. There wouldn't be any cooperation. Be open to that, but I think putting that onus on the employer, they're not going to know what the hell they're doing. I mean, they're not going to know, so-and-so came in and said I feel like that caused more confusion, but I would be open to the out-of-state compartment. I don't know if anyone's brought that up.
And to be clear, the health department is going to set out procedures for these employers. This is not something they're going to be left to do and guess. There are procedures that will be promulgated by the health department and Department of Labor to ensure that employers know how to respond to a catastrophic health crisis, how to report these things when they occur. So it's not like they're going to be left in the dark calling their parents. There are procedures that are going to be put in place. The onus is not going to be on, this is no heavy onus on employers. All it is requiring them to be part of, make sure not the statistics, but that it is known that there was an infection or an outbreak in their office. That's the key. There's already been procedures set out. They don't have to worry about recreating that wheel.
Delegate Howard.
Well, I mean, I think that's, I put my hand down, but I mean, none of this is in place now, and the contact tracing is going on through the local health departments now. And there is no onus on employers to report that. So they've got that information from the people that are being tested. Anyway, but Pippi basically covered what I was going to talk about.
Madam Vice Chair.
I would support sort of not resisting the amendment and just ask everyone to keep in mind, I think it's fair to ask the employers to report to the Department of Health. But aside from that, the bill also includes provisions regarding, having the departments prepare a master plan, so to speak, of what is going to happen. And certainly if as part of that plan and subsequent report to us, the health department said something different, I think we can consider it. But, I do think that the purpose in keeping the healthy place means it's appropriate for the employers to do it, unless eventually, as part of the overall health preparedness plan that we've asked people to put together, says differently.
Can we make a motion, or do you want to keep talking, Mr. Chair?
Let me go to Delegate Aaron. I want to make sure everybody's that wants to weigh in on it has an opportunity.
My only thing is, I think having any employer, even though they'll be aware of it, but making it public like that kind of violates my personal privacies, in my opinion. I would rather you not know what's going on with me. Even, Mr. Chair, if I had it right now, I'd rather you not know about it and I go about my business, even though I wouldn't be at work. But that to me seems like it's personal. It takes that problem off the employer. It's personal privacy, personal privilege. So I would support the amendment. Thanks.
And just again, colleagues, to be brief, this is a catastrophic health emergency. This isn't a cold or the flu. This isn't any STD you might catch. This has to do specifically with a communicable disease that may in fact infect the entire state, region, or office. So these aren't normal times that we're talking about. This is when the governor declares a catastrophic health emergency. And under those circumstances, it may be something you would not normally do. But in these circumstances, you would want to make sure that if your coworker was working beside you and came down with COVID, you would want to know as soon as possible, because you would want to not only protect yourself, but you want to isolate to protect your family. And that's what we're trying to create, that expediency to make sure that you can protect your family and your loved ones if you know you were working next to somebody who got COVID yesterday.
I would agree with you, Delegate, except that we've had so many false positives, and I don't see that being any different if we have another problem where as soon as I'm notified, how many false positives we've seen during this pandemic and everybody's fine. We've seen that in the Senate. We've seen it everywhere with the test kits and what have you. So I just think that I understand your point about if it's catastrophic, but this has been catastrophic. And there's been so many times where you look at the Senate, they almost canceled because they had 5 in a row. I think it's let the health department worry about it, and they would control far better than me.
Those were rapid tests.
Delegate Adams.
Council, just real quick, just for the sake of making a record on this, the bill, the way it's written, if an employer fails to inform the Department of Health of a positive test where the employee has gotten the test, and not inform the employer, would they be in violation of the article?
Yes. They'd be in violation of the subtitle.
Okay. As it's currently written.
Mm-hmm.
All right. I see.
This is the bill you didn't vote for already.
So if CT works for Chris Adams, he gets a test but refuses to give me the results of the test, I would still be in violation of the article if I do not get that information from the employee and report it to the Department of Health.
Well, if you didn't have knowledge of the test result, then there wouldn't be an expectation that, you share that with the Department of Health.
How can you share something you don't know?
You're asking a legal question or a practical?
Oh, both.
I think Delegate Pippi had his hand up again.
Delegate Pippi.
Thank you, Subcommittee of Regulations Chair, for acknowledging me. So, maybe it's written in there. We have two tests in Annapolis. We have the rapid test, which does have like a 10 to 15% or a 10% false positive rating. And then we have the PCR, which is pretty consistent. So as the bill is written, if an employee fails a rapid test, tells an employer and then gets a permanent test, the permanent test says he's negative, does the employer have to report that failed rapid test or face violations?
This section of the bill requires employers to report only positive tests.
Yeah, so a failed test would be a positive test. So
Okay.
a positive rapid test, and then add 6 PCRs after that are negative. Would the employer report that failed rapid test?
No.
Oh,
Sorry, I think I'm getting hung up on the way you're saying failed. So positive or negative, the bill
I'll
only
stick to
requires
positive. So
disclosure.
an
Positive.
employee gets a positive rapid test, calls his employer and says, hey, I had a positive rapid test. And then the employee gets a PCR, which is the more permanent test, and it's negative, and then has 6 negatives in a row. Does he have to report that positive rapid test to the health department or face violation with this bill?
yes. He should have reported it as soon as he found out.
Got it. So he's already reported it.
He's already reported it. You can't unring that bell.
Yeah.
Okay.
No, that CT, respectfully, that's not true. I had a
I'm
friend,
sorry?
I said,
What's not true?
that's not true, because I had a friend who got the test and came up and she was found that to have it. And then she went to her doctor, had the better test done, and she didn't have it. So
How many days did that take, Rick?
it took
How many
2.
days?
Took 2.
Exactly. So what we want is we want somebody, when they find out they're positive, to assume the worst, inform the employer, their employer informs the health department, make sure they're doing everything they need to do and protect all of their people. If it comes back that test was incorrect, God bless them. But in the meantime, they protected all their other employees and made sure that those employees were able to protect their loved ones in a communicable disease.
So what are we doing to unreport the false test? That's one of the problems. See, these tests are going to be
It's not a
used
problem
as
with me.
numbers to say things are going up. We found this many people, but the truth of the matter is there's this many people testing positive. There isn't that many people testing positive because a percentage of them are testing false positive, and there's no way to remove them from the list.
And
problem here, and these numbers, CT, as you know, are being used to close schools, to be close businesses, to do this, and that's the problem with this. And the employers are just not experts. So the employer finds out, and within 24 hours, he's told that test wasn't true. Now the person never came in, and that over the weekend. So that's why I got a problem.
And to be clear, our job is not, the goal of this is protecting essential workers. Not truth in statistics. Ensure that the health department has the exact numbers. We're not trying to correct what has happened in the past with the false positives. This bill is to protect essential workers.
The statistics are what we're using to protect the workers.
No, we're not. We're using our
Constantly,
practices.
all the time.
I got you, but today we're using our practices. We're using what we're requiring our employers and employees to do.
Okay.
Hey, gentlemen, we're
Okay,
being
but you're wrong.
argumentative.
Sure, we'll be saying this
Delegate-
again on the floor.
Delegate Walker.
Yeah, I was going with the debate. I mean, no, what we're doing is protecting people. We can harp on the false positives, but you got to harp on, you can't be naive. And you put people at risk, at danger, if you've got a test and you feel like I don't have to tell anybody. That's how things spread. So requiring that, yes. And if you come back with a false positive, then I think your coworkers, I would want to know, yes, it was a false positive. What I don't want to do is find out that you had it for 2 weeks and you were sitting right there working next to me and nobody did anything about it. Because then you put my family, your family, a lot of people at risk. The false positive, I hope it is false positive. You don't have it. But the reality is, this is something, an emergency situation, and people have a right to know.
Jay being a team player. Go ahead, brother.
Delegate
And
Charkoudian.
it's hard to be on your team, see. Want to help me, you don't want to.
He just walks right into stuff. Charkoudian, did I see your hand up?
It was. I'll just take the opportunity to mention how much I like being on Delegate Wilson's team as well. And to say that I think that we can trust the health department when they work out the regs to figure out what to do with false negatives or with false positives. There will be regs that come out of this. And we do need the data on what's happening within the workplace itself in order to put the steps into place. And so I hope we can move unfavorable on this amendment.
Delegate Howard.
Thanks, council. Just because we've gone all over the place, what does this amendment do again?
This amendment requires a testing facility instead of an employer to report the positive test cases to the Department of Health.
Okay, does it all? Okay,
That's all it does.
That facility would collect employment information and have patient data, testing data, that patient's exact information there as they're being tested. I think it's wholly appropriate. Thank you.
I think we beat this to death. This is the bill that's from, well, I won't insult it since my name's on it, but oh my gosh, every issue on this thing is, well, I guess that's a good thing though. It's important. It is an important issue, and you need to flesh out all of the possibilities. So, but now we're there. We need, this is.
Resist the amendment.
Second.
All right, this sounds like a roll call to me. So let me do that. Vice Chair.
Yes, I'm resisting the amendment.
Delegate Brooks. Delegate
Excused.
Brooks is excused. Delegate Fisher.
No to resist the amendment, if that's what we're voting on. I just thought it made more sense to do yes or no on the amendment rather than.
Let me put it in terms.
Okay,
The motion
sorry.
is an unfavorable. So Delegate Dume had a yes on the unfavorable.
Correct.
Delegate Fisher had a no on the unfavorable.
Thank you. Appreciate that.
Delegate Queen.
Yes. Yes.
Delegate Turner. Delegate Turner, unmute yourself, Delegate.
Okay. Unfavorable is yes, right?
Yes.
Okay, yes.
Delegate Rogers.
Yes.
Delegate Carey.
Yes.
Delegate Jackson.
Yes.
Delegate Pippy.
No to the unfavorable.
Delegate Mouts.
No to the unfavorable.
Delegate Wilson.
Yes to the unfavorable.
Delegate Impalaria.
No to the unfavorable.
Delegate Branch.
Aye.
Delegate Valderrama.
Aye.
Delegate Walker.
Aye.
Delegate Chi.
Yes.
Delegate Adams.
No.
Delegate Arentz.
No.
Delegate Fennell.
Yes.
Delegate Charkoudian.
Yes.
Delegate Howard.
No.
Delegate Crosby.
Yes.
And Delegate Watson. Delegate Watson with us? No, she was.
Sorry, I was muted. Yes.
Motion carries. Was that Buckle or?
That was Kipke.
All right, let's go to Buckle's amendment.
Delegate Buckles' amendment removes the authority for the commissioner in the commissioner's discretion to direct the payment of an additional amount of up to 3 times the value of the essential worker's hourly wage for a violation of the leave provision of the bill. The enforcement provision of the bill for leave is modeled after what's in the Maryland Healthy Working Families Act. So
So we just moved that over basically?
right? Except for the private right of action is not in this subtitle. But Delegate Buckles proposing to remove just that part of the enforcement and remedies provision.
Just
the treble damages.
Discretionary. It's discretionary, but yeah.
Okay.
Mhm.
Anybody?
I think I'd move to resist the amendment based on the fact that we did not put the private right of action in, which is a big deal. And it is discretionary. So I'm, assuming the commissioner will make an appropriate determination that, if it was really egregious and perhaps repeated, maybe treble damages is correct. If it, a one-time routine and was done by mistake, I don't think they're going to get damages. Again, it's going to be in a crisis situation. I think before damages are awarded, they're going to be looking for an egregious situation.
I think it's also important to point out that the leave has to be funded, right?
That's true.
So
too.
I think that it's a lot,
Right.
the enforcement cases that would arise and the issues, I think it's just a different sort of scenario than would arise absent the funding component.
It literally is the fact that that's all we resist. This would take effect if the governor determines that the employers are going to be compensated for any financial loss due to the leave. So I don't believe the employer is going to they're not going to take a financial hit on this. So I can't imagine they'd be resistant. And the vice chair said it's that they don't have to give treble damages. They can look at the totality of the circumstance, find out if it was an accident, it was done on purpose, and then and only then allow treble damages in those instances. And again, this is money that was going to that the employers will be compensated for. So I find this amendment wholly unnecessary.
Delegate.
Just briefly, and remember, think about what businesses are going through today. A violation of the law doesn't mean that they knowingly violated the law. They may have said to an employee that they have the right under this bill to refuse them taking leave if they believe it's being abused. Of course, that hits a commissioner's determination. Not every future commissioner is going to be a pro-business commissioner. And, I think that the idea that we would ever think under a extreme event like this that we would be interested even in contemplating treble damages. I mean, we may be interested in making the employee whole, but to deliver punitive damage against the business is at least somewhat egregious in my opinion.
Anyone else? If not,
I move to resist the amendment.
Second.
all in favor signify by aye.
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 Opposed, nay.
Nay.
That sounds like 16-7 to me.
It does.
But if anybody wants a roll call, let me know and I'll do it.
Chris?
I think we got it.
Seeing none, the motion, which was to resist the. So, all right. So let's go on to our to our regular voting list. I want to move around just a little bit, guys. Can we start with Senator Washington's bill, SB 31?
Senate 31 is the cross file to House 397, which is Delegate Learmon's bill on protecting the of making sure that the electricity and gas customers who are on public assistance from the Electric Universal Service Program or LIHEAP are not charged more than they would be at SOS. The Senate bill, there's an amendment in your packet to conform the bill to the House bill. What the Senate did was to do approximately what the House bill did, but then they also put on a fairly extensive educational component for going out and making sure that the low-income customers know that they can shop and what the various kinds of contract terms are essentially setting up a new education program similar to what we did when we deregulated.
Move to conform with the House and adopt the amendments.
Second.
Moved and seconded on the amendment. All in favor signify by aye.
Aye.
Opposed, nay. On the bill as amended.
Move the bill favorable with amendment.
Second.
Moved and seconded. Are there any questions? If not, Madam Vice Chair,
Yes.
Delegate Watson,
Yes.
Delegate Crosby,
Yes.
Delegate Howard,
No.
Delegate Charkoudian,
Yes.
Delegate Fennell,
Yes.
Delegate Arentz,
No.
Delegate Adams,
No.
Delegate Chi,
Yes.
Delegate Walker,
Yep.
Delegate Valderrama,
Aye.
Delegate Branch,
Yeah.
Delegate Impalaria,
No.
Delegate Wilson,
Yes.
Delegate Mounts, is Delegate Mounts out there?
He seems to have stepped away.
All right, Delegate Pippy,
No.
Delegate Jackson,
Yes.
Delegate Carey,
Yes.
Delegate Rogers,
Yes.
Delegate Turner,
Yes.
Delegate Queen,
Yes.
Delegate Fisher,
No.
Delegate Brooks. Is Delegate Brooks there? Excused, Delegate Brooks. And if Delegate Mounts has not returned, he will be listed as excused as well. All right. How about Senate Bill 131?
Senate Bill 131 is the cross file of House Bill 726, which received an unfavorable report from the committee.
Move unfavorable.
Second.
Moved and seconded for an unfavorable for Senate Bill 131. Does anyone wish to be recorded in opposition to the unfavorable? Seeing none, Delegate Brooks is excused, as is Delegate Mounts. That's Delegate Patterson's bill.
Yes, I want to be for that bill.
Okay.
Oh, I think she's.
Hold on, I got
You
it.
haven't gotten
She's
to
voting
me.
against.
I'm sorry.
I got it. She's voting against the unfavorable.
Yes, that's it.
All right. Delegate Turner is a no. Delegate Brooks is excused. Delegate Mounts, if he hasn't rejoined us, he's excused as well. All others present.
Mr. Chair,
Yes,
can I be recorded as a no against the unfavorable?
you can.
And, and
Way to go,
Mr. Chair,
CT.
Mr. Chair, also,
Mr. Nate.
Diana Fennell, I know.
Uh-oh.
Anyone else? All right, all others present voted aye. Motion carries. Senate Bill 135, please.
Senate Bill 135 is the cross file of House Bill 261. That's Delegate Branch's bill about battery charged fence security systems. There is an amendment in your packet to conform the bill to House Bill 261. You'll remember on the floor, Delegate Delegate Shalega offered an amendment to clarify the scope to make sure that it doesn't include deer or livestock fencing. You all also just you tried to go to conference over at the House.
It's my
They receded.
Right.
They receded.
Right,
So
move
we
the
just need
amendment.
to put this on it and we're good.
Okay, move the amendment.
Second.
All in favor signify by aye.
Aye.
Opposed, nay. Motion carries. Does anyone wish to
Move the
be,
bill as amended.
Second.
does anyone wish to be recorded in opposition to the bill?
Delegate
Is
Fisher.
excused. Delegate Mouts, has he rejoined us?
No. he is
Not, he's excused. Is Delegate Fisher with us?
Yes.
Oh, okay. So anyone wish to record in opposition? If not, we have just the two excused.
Delegate Fisher raised his hand.
Yes.
Delegate Fisher.
That's correct. That's a no.
I'm back.
That's a no for me.
Okay.
Oh, okay, Delegate Fisher's enough. Who just said
Mr.
they're
Chair-
back?
I'm Aaron.
Aaron's.
I'd be a
Oh, I didn't
no.
know you were gone.
Oh, well. Then you have my vote.
Welcome back, sir. Anyone else?
So Aaron's is a what?
No.
Thank you.
Aaron's is a no as well. Anyone else? All right. All others present voted aye. All right. 473 looks like another crossfire.
This is a cross file of House Bill 56. It's identical. This is the bill that amends the Flexible Leave Act to allow for bereavement leave of an immediate family member.
Move favorable.
Second.
Moved and seconded for favorable. Madam Vice Chair,
Yes.
Delegate Brooks is excused. Delegate Fisher,
No.
Delegate Queen,
Yes.
Delegate Turner,
Yes.
Delegate Rogers,
Yes.
Delegate Carey,
Yes.
Delegate Jackson,
Yes.
Delegate Pippy,
No.
Delegate Mouts is excused. Delegate Wilson,
Yes.
Delegate Impalaria,
No.
Delegate Branch,
Yep.
Delegate Valderrama,
Aye.
Delegate Walker,
Yes.
Delegate Chi,
Yes.
Delegate Adams,
No.
Delegate Aaron's,
No.
Delegate Fennell,
Yes.
Delegate Charkoudian,
Yes.
Delegate Howard,
No.
Delegate Crosby,
Yes.
and Delegate Watson.
Yes.
Motion carries. Senate Bill 801, please.
This is identical to House Bill 1154 as passed by the House. That was Delegate Jackson's bill that made a number of changes to the Economic Stabilization Act.
Move favorable.
Second.
Moved and seconded for favorable on Senate Bill 801. Madam Vice Chair,
Yes.
Delegate Watson,
Yes.
Delegate Crosby,
Yes.
Delegate Howard,
Sorry, say the bill number again.
801.
801.
I think you were a no on the House bill.
I think I was too, and I just want to check.
Of course he was.
HB or SB?
Senate Bill 801.
Thank you.
Delegate Howard, you were a yes on the House bill on the floor. Passed 111 to 24.
Yeah, I'm
What?
looking at the votes now. Coming out of
Mr.
the
Chair, it
Senate.
looks like Delegate
This helps
Charkoudian
us,
has a question.
the
Hold
unions
on,
are
everybody.
against.
Hold on.
We're in a
All
roll
right,
call.
what do you want to do, Delegate Howard?
Hold on, it looks like it coming out of the Senate committee and the House clean. I'll go yes.
You go yes, okay. It's Charkoudian.
Yeah, Mr. Chair, I'm sorry. Is this in the same posture as
Same
the?
posture.
Yes.
Okay, yes, then I'm a yes on it. Thank you.
Delegate Fennell,
Yes.
Delegate Aaron's,
No.
Delegate Adams,
Chairman, what did I vote on the other bill? I'm sorry.
You are, Delegate Adams, you are a yes too. I had the vote sheet up.
Oh, trusting Crosby. That's cool.
I wouldn't. Well, why didn't he help? Why didn't he help me?
You are a yes as well, Delegate Aaron's.
You know why, Ernst.
What do
He
you
voted too
think?
Fast.
What do you
He didn't
think,
phone a
Delegate
friend.
Adams?
No, Aaron says no. Aaron says no.
I went no, Chair. I'm okay with it.
Hold on, everybody. Hold on. What do you think, Delegate Adams?
Oh, I'm yes. Thank you.
All right. Delegate Chi,
Yes.
Delegate Walker,
Where'd he
did
go?
we lose Delegate Walker?
He's on
See,
mute.
now
he's
we,
there.
we confused him now.
Yeah.
Big time.
He might be eating.
Yeah.
Delegate Valderrama, ignore him. Delegate
Pay
Valderrama,
no attention, man.
Aye.
Delegate Branch,
Yes.
Delegate Impelleri,
No.
Delegate Wilson,
Yes.
Delegate Mouts is excused. Delegate Pippi,
Yes.
Delegate Jackson,
Yes.
Delegate Carey,
Yes.
Delegate Rogers,
Yes.
Delegate Turner,
Yes.
Delegate Queen,
Yes.
and Delegate Fisher.
No.
Delegate Brooks is excused. Motion
Where
carried.
was Walker?
Walker was a yes. All right. Senate Bill, House Bill 467.
House Bill 467 from Delegate Rogers is the bill that would reinstate Tier 2 for hydro facilities indefinitely and establish certain percentages within the RPS for that. There's an amendment offered by Chair Economic Matters that would also take that and do a slight decrease for several years of the percentages in the solar band, and also increase correspondingly some out years for the alternative compliance payments based on language that was proffered in the Senate at the request of the solar industry. I can share the reprint if you would like.
Anybody want to see it?
Favorable on the amendments?
Is there a
Second.
second? Delegate Charkoudian.
I was just going to clarify, these are amendments that the solar industry requested, correct?
They were actually originally put onto the cross file in the Senate, but that bill did not make it for other reasons on the Senate floor. But these amendments adjusting the ACP and adjusting the solar band were requested by the solar industry because they've been impacted. Their capacity to install has apparently been impacted by COVID, at least according to their testimony.
Great, that's what I, thank you. And I'll second the amendment.
Say that bill number again, Bob.
467.
Thank
House
you.
Bill, House Bill 467.
Thank you.
All right. All in favor signify by aye.
Aye.
Opposed, nay. On the bill as amended.
Move favorable.
Second?
Moved and seconded for favorable as amended on House Bill 467. Any discussion? If not, Madam Vice Chair,
Yes.
Delegate Brooks is excused. Delegate Fisher,
Oh.
Delegate Queen,
Yes.
Delegate Turner,
Yes.
Delegate Rogers,
Yes.
Delegate Carey,
Yes.
Delegate Jackson,
Yes.
Delegate Pippi,
No.
Delegate Mouse is excused. Delegate Wilson,
Yes.
Delegate Impeleria,
No.
Delegate Branch,
Yes.
Delegate Valderrama,
Aye.
Delegate Walker,
Aye.
Delegate Chi,
Yes.
Delegate Adams,
No.
Delegate Aaron's,
No.
Delegate Fennell,
Yes.
Delegate Charkoudian,
Yes.
Delegate Howard,
No.
Delegate Crosby,
Yes.
and Delegate.
I think I was frozen. Did you call me, Derek?
Yes, ma'am.
Yes.
Motion carries. Senate Bill 65.
Senate Bill 65 is the cross-file to Delegate Davis's House Bill 875 that removes black liquor from qualified biomass in Tier 1. There is an amendment in your packet. This is the end of session, so life gets interesting. The amendment actually amends what you just passed in House Bill 467 onto Senate Bill 65 as well.
Okay, move the,
Don't ask questions. Let's just.
no, just move the amendment.
Second.
Second.
All in favor signify by aye.
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 Opposed, nay. Delegate Adams.
Mr. Chairman, could I ask for a courtesy hold on this bill for the purpose of an amendment?
Yes, sir. So we are, the first set of amendments were adopted, and we will take up Delegate Adams' amendment tomorrow. And with that, I believe we have completed, we've completed, we should be voting tomorrow unless we're still on the floor from, you're supposed to laugh at that, guy.
We also do have some concurrences, Mr. Chairman.
Okay, let's knock the concurrences out.
Okay, first of all, if I'll jump in, House Bill 12, Delegate Watson's delivery and takeout bill. The Senate bill, the Senate took it and amended it to look like theirs, which we amended to look like hers. The Senate amendments are the ones that provide local government oversight over delivery, and also have a health department required report. You indicated that you'd like to appoint yourself, Delegate Branch, and Delegate Watson as conferees, if that's what the will of the committee is.
Right, move not to concur.
Second.
Conference committee.
All in favor signify by aye.
Aye.
Opposed, nay. All right, move not to concur.
House Bill 569, the Senate, we've already passed the Senate version of this with the corresponding language. This is Delegate Clippinger's increase of the net total net metering cap. They found, or I found, and they corrected a cross-reference in the next section. So we would be concurring.
Sounds like a technical amendment.
So moved.
Correct.
All right. All in favor signify by aye.
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 Opposed, nay. Motion carried. Motion to concur carries.
Okay. I think Tiffany had one.
Yes, we have HB 658, which is Delegate Cheese, Transforming Manufacturing in the Digital Economy Work Group. The Senate amendments add the three more members to the work group.
What
Did
are
you do that to the House bill?
So
Or
the
this-
House, I'm sorry, can you repeat that?
So just remind me the status. So this is the House bill that we're
This
talking.
is the House bill that we're talking about. We passed the Senate bill by striking these three. And so the Finance Committee they've refused to concur on the changes that ECM has made.
Can you
Mr. Chair.
as to who they added or who they want?
Absolutely. One representative from a small minority-owned manufacturing business. One representative of the Printing and Graphics Association Mid-Atlantic, and one representative of the Maryland Small Business Development Center.
Mr. Chair, I would like to suggest that we just adopt these three positions because they requested to be added to the work group.
Yeah, I was wondering, is there a method to the madness of why we would keep them out, Mr. Chair?
We don't want them.
Are we down to that again?
I don't care. I don't care. If
They're just volunteers,
you're
you know.
fine with it,
Yeah, I'm fine
I
with
can
it.
only speak for me. Can't speak for the rest of you.
All right, so are we concurring? Is that the
That's what it's,
motion on the House bill would be to concur? Is that right, Tiffany?
yeah.
Oh, yes, yes,
Keeping these on? Okay.
correct.
All right, so then motion to concur.
Second.
So that means that little to-do we had on the floor was a big waste of time the other day.
Well, I
It's
just
a
didn't know
different
if you had a,
organization.
it's different organizations, isn't it?
Yes.
But that was only because, or the lead in the preamble to that was because we didn't include those organizations.
No, Mr. Chair, I think you were referring to one specific organization that did not ask to be included, and you were correct about that. So National Association of some independent business.
No, I get that, but
Yeah.
in the delegate's opening thing, you remember he asked me were all these groups not included?
Oh,
And,
okay.
and that led into everything else. So, but in any event,
okay.
that's
okay.
that. It's certainly not worth. Yeah, if
Going on a
you guys are
sword,
fine.
Yeah, I agree.
All right,
It's not
all in
worth-
favor signify by, we adopted it, right? Well, let's adopt
I
it a
made the
second
motion,
time.
but yeah.
Made the motion.
All in favor signify by aye.
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 Opposed, nay. All right, so we'll just, let's do it preemptively. When they ask us to recede on the other bill, we'll recede on from the House's position. So we don't have to have this discussion again. All right?
All right.
So they'll do it to the House bill as well, and we'll recede, and the three groups will be on it. All right, anything else? You got anything else for me, Bob?
I don't.
Tiffany,
Nothing.
Laura?
No, sir.
All right, any subcommittees need to meet or?
Hope not.
Mrs. Reg?
Bite your tongue.
Can we say never again?
Yeah. Just second.
CT, if
Never
you'd like to
again,
meet.
never
CT,
again before next week.
Right.
Right.
CT, if you missed us, we can always come by and,
Listen, guys, you all have been doing a great job. I can't say it enough. Everybody's been working hard and meeting and just doing a yeoman's effort. So do know that while we kid because we love, the hard work is certainly noted and greatly appreciated. You have my respect and admiration for all that you're doing. With that, you have, I guess, 45 minutes or whatever it is before the various caucuses, and then we'll go on the floor. Delegate Rogers, I'm sorry.
Yes, Mr. Chair. So given all those accolades you just threw our way, does that mean you're also going to throw a party our way that's socially distanced and all of that,
Absolutely. Meet me
All
here
right.
April 13th. And we will get it in, as they say. We're going to have a good time.
For the
Still
record,
live.
class never
Mr. Chairman,
Yes, ma'am.
Delegate Turner wants to personally thank you for everything you have done. You have been a great chairman.
Well, thank you. I appreciate it. Before this gets too mushy, let's just say goodbye. And,
It's getting uncomfortable.
and we'll see each other in just a little bit, okay?
Okay.
Take care,
Mr. Chairman,
everybody.
I'll make sure
You guys are good.
I play that song next time.